40 PANCE Practice Questions Antibiotics with Answers and Explanations Part 1. Hello, welcome to the Science Guide ASAP Learning. Today, we are going to be practicing 40 PANCE style questions. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 1. A 68-year-old man presents to the emergency department with fever and productive cough for the past 4 days. A chest X-ray reveals consolidation in the right middle lobe. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Cephalexin. B. Amoxicillin clavulinate circa levofloxacin. D. Vancomycin. Answer: circa levofloxacin. Explanation: the patient presents with clinical and radiographic findings consistent with community-acquired pneumonia, CAP. The most common bacterial pathogens associated with CAP include Streptococcus pneumoniae, Haemophilus influenzae, and atypical organisms such as Mycoplasma pneumoniae, Legionella pneumophila, and Chlamydia pneumoniae. Levofloxacin, a fluoroquinolone antibiotic, is a recommended empiric therapy for CAP in patients with no risk factors for drug-resistant pathogens. Question 2. A 28-year-old woman presents to her primary care physician with a red, painful, and swollen wound on her leg. She reports that she was bitten by her neighbor's dog 2 days ago. The wound is warm to the touch, and there is purulent drainage. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Ampicillin sulbactam. B. Ceftriaxone circa ciprofloxacin. D. Trimethoprim sulfamethoxazole, TMP-SMX. Answer: A. Ampicillin sulbactam. Explanation: the patient presents with clinical and physical examination findings consistent with a skin and soft tissue infection, SSTI, caused by a dog bite. Empiric therapy for SSTIs should cover gram-positive cocci, gram-negative rods, and anaerobes. Ampicillin sulbactam, a beta-lactam, beta-lactamase inhibitor combination, provides coverage for these pathogens and is an appropriate initial therapy for this patient. Question 3. A 52-year-old man with a history of methicillin-resistant Staphylococcus aureus, MRSA, pneumonia is admitted to the hospital with a fever and purulent drainage from his tracheostomy site. Which of the following antibiotics is the most appropriate therapy for this patient? Ceftriaxone. B. Gentamicin circa linezolid. D. Piperacillin tazobactam. Answer: circa linezolid. Explanation: the patient presents with clinical and microbiologic findings consistent with an infection caused by MRSA, a common multi-drug-resistant pathogen. Linezolid, an oxazolidinone antibiotic, provides excellent activity against MRSA and is a recommended therapy for infections caused by this organism. Question 4. A 32-year-old woman presents to the emergency department with severe abdominal pain, nausea, and vomiting. A computed tomography (CT) scan reveals a large fluid collection in the pelvis consistent with a ruptured appendicitis. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Azithromycin. B. Cefepime circa metronidazole. D. Penicillin G. Answer: B. Cefepime. Explanation: the patient presents with clinical and radiographic findings consistent with a ruptured appendicitis, a surgical emergency that requires prompt intervention. Empiric therapy for intra-abdominal infections should provide coverage for correct gram coverage. Question 5. A 35-year-old woman with a history of recurrent urinary tract infections presents with fever, chills, and flank pain. Urine culture shows growth of E. coli. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Ceftriaxone. B. Ciprofloxacin circa trimethoprim sulfamethoxazole, TMP-SMX. D. Amoxicillin clavulinate. Answer: D. Amoxicillin clavulinate. Explanation: amoxicillin clavulinate is a first-line agent for uncomplicated urinary tract infections caused by susceptible organisms. It has excellent activity against E. coli, and the addition of clavulinate helps to prevent the development of resistance. Question 6. A 68-year-old man with a history of chronic obstructive pulmonary disease, COPD, presents with fever, increased sputum production, and worsening dyspnea. Chest X-ray reveals a new infiltrate. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Azithromycin. B. Ciprofloxacin circa ceftriaxone. D. Vancomycin. Answer: A. Azithromycin. Explanation: azithromycin is a first-line agent for the treatment of exacerbations of COPD. It has excellent activity against the most common pathogens associated with exacerbations, including Streptococcus pneumoniae and Haemophilus influenzae. Question 7. A 25-year-old woman presents with a rash and fever after starting a new antibiotic for a urinary tract infection. The rash is maculopapular and involves her trunk and extremities. She denies any respiratory or gastrointestinal symptoms. Which of the following antibiotics is the most likely cause of this reaction? A. Ceftriaxone. B. Azithromycin circa trimethoprim sulfamethoxazole, TMP-SMX. D. Amoxicillin. Answer: D. Amoxicillin. Explanation: this patient's rash is most consistent with a drug hypersensitivity reaction, specifically a morbilliform rash. Amoxicillin is a common cause of this type of reaction. The other antibiotics listed are less commonly associated with morbilliform rashes. Question 8. A 42-year-old man presents with a purulent skin infection on his lower leg. He reports that he is allergic to penicillin and cephalosporins. Which of the following antibiotics is the most appropriate initial therapy for this patient? A. Clindamycin. B. Erythromycin circa doxycycline. D. Vancomycin. Answer: A. Clindamycin. Explanation: clindamycin is a first-line agent for skin and soft tissue infections caused by susceptible organisms. It has excellent activity against staphylococci and streptococci, which are the most common pathogens associated with these infections. It is also effective against some anaerobic organisms. Question 9. A patient with a history of chronic kidney disease presents with a bacterial infection. Which of the following antibiotics would require a dosage adjustment in this patient? A. Amoxicillin. B. Ceftriaxone circa vancomycin. D. Azithromycin. Answer: circa vancomycin. Explanation: vancomycin is primarily eliminated by the kidneys, and thus, requires dosage adjustment in patients with renal impairment. Question 10. A patient with a history of liver cirrhosis presents with a bacterial infection. Which of the following antibiotics would require a dosage adjustment in this patient? A. Amoxicillin. B. Ceftriaxone circa vancomycin. D. Azithromycin. Answer: B. Ceftriaxone. Explanation: ceftriaxone is primarily eliminated by the liver, and thus, requires dosage adjustment in patients with hepatic impairment. Please like, subscribe and comment below. Make sure to watch part 2.